I'm Tanner Phillips from the Ganawagi Fire Brigade, and I'm a paramedic. And I'm going to be talking to you a little bit about opiate overdoses and how to administer the Naloxone nasal spray for someone who may be overdosing.
I'm Kyle Zachary from the Ganawagi Peacekeepers. I'm here to tell you how the Ganawagi Peacekeepers respond to drug overdose calls.
So opiates are a class of medication that's used to treat pain. Obviously it is by prescription only, and when taken in large quantities, of course, they can cause the person to become unresponsive and eventually stop breathing, and if left untreated, it can result in death. So it's important that everyone understands what opiate medications are, and people going through their medicine cabinet might find a couple of these in there. It's important that you understand that these are opiate medications. So things like morphine, Dilaudid, Superdol, codeine, those are all medications that are prescribed for pain and are opiate medications.
So when the Ganawagi Peacekeepers respond to a call of an overdosing person, our first duty is to preserve life. So we've seen in the past where people who are with people who are overdosing, they're afraid, they're fearful of calling for help for the peacekeepers. They're afraid of prosecution because of the situation that they're in. There are Good Samaritan laws in the province of Quebec that have been on the books since 2017. It provides basic immunity to a person if they're administering aid, if they're calling for someone who's overdosed. It provides basic immunity. You can't be charged with possession. You can't be charged with breaching your condition. However, it depends on the amount of drugs that are on scene. If there's enough drugs there that we believe there's trafficking going on or production of some kind, then there could be prosecution that could come for that.
So I'm going to talk to you a little bit about the signs and symptoms that you might see when someone's experiencing an opiate overdose. So one of the main signs that you're looking for if someone is overdosing is someone who's unresponsive. So they won't respond to their name being called. They might not respond if you're doing a sternum rub. They may kind of groan, but they're usually typically completely unresponsive. Breathing, it may be very slow. It could be kind of like, you might have snoring, what sounds like snoring, or have gurgling sounds, or they can be completely not breathing. There's a couple other signs that you might see. So their pupils could be pinpoint. Their skin may be cool and clammy. They might be a little bit like sweaty. But typically the two signs that you're looking for in order to give the medication to reverse the overdose is the irregular or absent breathing and the unresponsiveness. Alright, so it's important to understand that although a majority of the people who do experience opiate overdoses are using non-pharmaceutical opiates that they obtain on the streets, there is a risk of overdose for anybody who's using prescription opiates for pain relief and such. So it's important to keep that in mind, that it's not only people who are getting medication off the street, but it can also happen to anybody who's using the opiate medications for pain.
Ganawagi Peacekeepers respond to an overdosing person. Our first duty is to preserve life. Every peacekeeper carries a dose of Naloxone, sometimes two, sometimes multiple doses. We secure the scene, we provide the necessary first aid, sometimes administering Naloxone on our own until the Ganawagi Fire Brigade arrives to secure the patient.
So a significant portion of people that we see who overdose on opiates actually also have stimulants in their system. So there's actually a lot of the medications on the street are being mixed with fentanyl unintentionally or intentionally. And so users who are typically going out there to purchase things like stimulants like cocaine or ecstasy or speed or something of that nature are unknowingly ingesting the fentanyl and can result in an overdose. So this opiate crisis doesn't only touch people who are using opiates. It also affects people who are using stimulants as well. So that's important to keep in mind. and that it's it's not limited to that one type of drug. All right, so I'm going to explain and demonstrate how to administer the Narcan nasal spray. So we have our dummy here. When you receive the medication from either KCS or the pharmacy, it'll come in a box, and there's 2 units in the box. So the Narcan is in a small little individually sealed packaging. This is the actual medication. I'm going to be using a simulator to demonstrate. When you open it from the packaging, there's also a small leaflet in there that you can read, and there's basic instructions on how to use the medication as well. So one thing to remember before you give the medication is it's ready to be given. You don't want to try to you don't want to test it. You don't want to spray it, because once you spray it, all the medication will be administered. So as soon as you open it from this package, it's ready to be used. So you come across your patient, somebody who's you suspect is having an overdose. You want to make sure that the first thing that you do is either you call for an ambulance or you have someone call for you. So make sure that you're getting help on the way before you start doing any type of giving any medication. So you have the person, you want to make sure that they're laying on their back, and you want to support the back of their head, maybe tilt their head back a little bit. The medication is going to be given in the nostril. So when you hold the nasal spray, you can just put it between your 2 fingers and put your hand on the plunger on the bottom, and just make sure again you don't spray it or test it, because once you spray it completely sprays the whole medication. So you have your patient laying on their back. You want to support the back of their head a little bit, put the plunger in the nose as far as you can go, and simply spray, push down, and give the medication. So after you've given the medication, you want to make sure that you position the person in what's called the recovery position. So typically it's on their left side. You can kind of position their hand under their head and use their knee to prop them up a little bit. You just want to make sure, if in case that they vomit, that they're not going to choke on their vomit. So you want to make sure that they're in this position. If you don't notice any change, if they're still not responding properly, or their breathing hasn't improved, or they haven't started breathing, and you have a second dose, after 2 to 3 minutes, you can administer another dose. So you want to, again, put them back on their back, administer the second dose in the opposite nostril, and then put them back into this position. If anyone wishes to get a Naloxone kit, they can go to the KSCS main building and ask for reception, or you can also go to a pharmacy and get one free of charge.
And if you need help, you can call us at 450-632-6505. As Gunawaga's first responders, we're here to help you.